evening, doctor. Why is so much panic about dengue fever? Is it a dangerous one? Because so many people are saying that it is dangerous. After an experience, people are saying, no, first 5 days you'll be very cautious.
Very correct, sir. Why it is considered dangerous disease? Last 20 years really shaking all the cities and towns of India. In 1990s, we had the first epidemic which affects Delhi. From that time onward, it started affecting all the towns and cities of India. This is a very rapidly spreading disease. In a short span, it can affect a whole district or state. That much it spreads very fast. Number one reason. Number two is a very unpredictable disease. We can't predict how the disease is going to develop further. Third is, after a certain age, like 1 year, 2 years, all of us will be very happy that our children will not have any problems. But disease can kill at any old boy or even 15-year-old boy after 5-6 days of fever. That much has got the potential to cause death. Fourth reason is, unlike the other diseases, most of other diseases, the serious complication will occur only at the peak of fever, like 104, 105. That time only problem will come. This is a very cunning disease.
Okay.
Dengue is a cunning disease. 5 days fever, and everybody is worried. 6th day fever stops. Then everybody starts sleeping. Okay, now the child is recovered. That is a period all the serious complications will develop.
What are the symptoms, sir? Any serious complications will arise out of this?
So to discuss the symptoms, I can divide into 3 stages. That's what we understood about the dengue disease. First 5 days, they present only fever. That is not a dangerous period. It will be like any other cold cough virus fever. You'll have fever, body pain, joint pain, eye pain, some will have even tooth pain. By end of 5th day, the fever stops. That is the beginning of a very serious complications. Next 48 to 78 hours after the fever subsides, what happens is, from the blood vessel, liquid component leaks out. Liquid component means water, salt, and liquid part of blood called plasma. Everything leaks out of the capillaries. Capillaries are small blood vessels. It doesn't go out of the body. It leaks within the body, so that the effective circulation is blocked. Blood circulation is the one which takes oxygen and glucose to all the body organs. So when the supply is cut off, it's something like a lorry strike, no gas supplied, no sugar supplied, no vegetable supply, the whole country is paralyzed. So similarly, oxygen supply and glucose supply is reduced, so that all the organs will start suffering within few hours. That is why the serious complication. Most of them will, the children will have stomach pain, vomiting, they will become very tired. A 15-year-old boy will be lying down and he won't even get up asking for food. He can't even get up to go for toilet. His urine frequency will reduce. When you touch and see the limbs, leg and hands will be very cold. You start seeing some red spots in the body. Some children may develop bleeding, vomiting of blood passage from the stools, all that can occur.
What is the treatment for this?
I think before treatment, I just want to tell you the cause of the disease. This is a viral disease. A virus called the dengue virus. There are 4 types: dengue 1, 2, 3, and 4. This virus causes the disease. I told you how it causes the disease. I told you. So basic, this thing is virus. How this virus enters to our body? Through the mosquito. And these mosquitoes, they have the virus in their saliva. When they bite a human being, it injects the virus into the body. And that's how the virus enters into the human body and causes all these problems.
What is the treatment for this?
Treatment is also a difficult one, because unlike this is like malaria, there is a different drug called chloroquine. There is a typhoid, there is a different drugs like antibiotic. Unfortunately, for most of the viral diseases like dengue, we do not have a specific medicine. Now I described to you about all the symptoms and signs. So the role of a doctor is to keep the child under observation. We will keep the child in the hospital, look at the pulses, look at the respiration, look at how the baby behaves, how much urine child passes. So very, very carefully we monitor, and from that any problem arises. The child develops bleeding, okay, we will give blood products. The child blood circulation is defective, then we have to give saline, we have to inject saline. And the child, sometimes it affects the liver and causes liver failure also. There is a liver failure, there are medicines for liver failure. So for depending on that, for every issue, it will be identified early, and then we give the treatment according to the problem the doctor observes.
I was told that dengue patient need much some blood cells, WBC, blue and platelets.
Platelets.
This
This is,
true.
yeah, but generally only less than 5 to 10% only get blood products. I mean, more than 90% may not need blood. So that was the situation earlier. Now we don't give blood unnecessarily, only when the child has got bleeding, blood in the vomiting, blood in the motion, or the blood bleeding from the nose. Unless the child has bleeding, generally blood products may not be needed. Other situation we will manage with the saline, and there are some more IV fluid called colloids, we will use them, and then only we will control it. Most of the time, more than 90% may not need blood products.
Is there any preventive vaccines? But otherwise, how to prevent this before?
This is, as I told you, this is a mosquito-borne disease. So if we control this mosquito breeding, then the disease can be prevented. Where this is a mosquito which breeds in clean water, daytime biting mosquito. So wherever there is water collection, for example, if I throw a coconut shell, the coconut shell can collect water in the rainwater. I'll throw a disposable tumbler or a bottle or car tires, the water gets collected. So these are the places where the mosquito breeds. If we avoid a situation of mosquito breeding, water collection mosquito breeding, we can control it. It is mainly a public health measure only. Or my water tank, my house water tank doesn't have a covering lid. It is open, no? The mosquito can breed in that. Or I collect water in the barrel or bucket in my house for my daily use. That also can give opportunity for the mosquito to breed. All this to be avoided. Regarding vaccines, so far they have not found out any vaccine which is effective against dengue disease. It's all under trial experimental stage. Maybe in another few years we might get the vaccines, and most of the parents and doctors will be happy. Otherwise, no, it's a disease. Not only makes the parents worry and panic, equally for the doctor profession also it's a very, very worrying disease.